We've all felt stressed at some point. It's just a natural part of life. But have you ever experienced something that felt way beyond normal stress? Maybe your heart started pounding so fast and hard that you thought it might burst, or you were so lightheaded and shaky that you couldn't focus on anything else. Sometimes these moments feel so intense that you might wonder if you're having a heart attack or if something is seriously wrong. These could be signs of a panic attack, not just regular stress. Panic attacks hit differently. They show up out of nowhere and feel overwhelming, both physically and emotionally. One of the most common symptoms is a racing or pounding heart, so intense it can feel like your chest might burst. You might even end up in the ER, convinced something's seriously wrong, only to have the doctor tell you everything is fine. Physically, at least. Sweating and trembling are also classic signs, and they don't need a reason like heat or exercise. Weren't out jogging, playing tennis, or drinking several cups of coffee. It just happens. And no, it's not something physical you ate or did. Shortness of breath can make you feel like you're gasping for air, adding to the panic that something awful is happening. But again, it's not like you just sprinted up a flight of stairs or did an intense workout. Other signs that it's a panic attack and not just everyday stress include dizziness or feeling faint, which can make it tough to stay steady on your feet. Nausea or stomach discomfort might hit, leaving you queasy and off balance, even if you haven't eaten anything weird or recent. Then there's the symptom that's hard to put into words but is a dead giveaway. That feeling of detachment or unreality. It's like you're disconnected from everything around you or watching yourself from the outside. Mix that with an overwhelming fear of losing control or even dying, and it's clear why panic attacks are so terrifying. If any of this sounds familiar, know that you don't have to keep living with it. Panic attacks and panic disorder are more common than you might think, and help is available. A mental health professional can work with you to understand and manage these symptoms, so you don't have to feel trapped or overwhelmed. You deserve to feel better, and you don't have to go through this alone. But wait, don't go. Here's what to expect if you see a therapist for panic disorder. If you see a therapist because you think you have panic disorder, the first session is usually about getting to know you, understanding your symptoms, and figuring out how they're affecting your life. Therapists will probably start by explaining how therapy works, reassuring you about confidentiality, and making sure you feel comfortable. Then, they'll ask about your symptoms. What happens during a panic attack? How often they occur? How long they last? And if there's anything specific that seems to trigger them. They'll also want to know how these episodes impact your daily life. Are you avoiding certain places or activities because you're afraid of having an attack? Has it made work, relationships, or other parts of life harder to manage? Your therapist will look into your medical and mental health history to get a bigger picture. They'll ask if you've had any recent health issues, whether you take medications or use substances like caffeine or alcohol, and if anxiety, depression, or trauma has been a part of your life before. Family history might come up too, just to see if there's a pattern. They'll explore your thought patterns and beliefs, like what goes through your mind during a panic attack and whether you're afraid of certain situations or worried about future attacks. At some point, they may use diagnostic criteria, like those in the DSM-5, to figure out if what you're experiencing fits panic disorder or something similar, like generalized anxiety or social anxiety. If it does, they'll explain their findings and talk about next steps. This might include therapy techniques like cognitive behavioral therapy, CBT, strategies to manage symptoms, or even suggesting you talk to a doctor about medication. It's a collaborative process, so being open and honest about your experiences will help the therapist create a treatment plan that works best for you. Summary: panic attacks are intense episodes of fear that differ from regular stress, often accompanied by physical symptoms such as a racing heart, sweating, trembling, shortness of breath, dizziness, nausea, and a sense of detachment or unreality. These episodes can feel overwhelming and frightening, leaving individuals feeling as if they're losing control or in danger. Fortunately, panic attacks and panic disorder are common and manageable with professional help. Seeking support from a mental health professional can provide relief and empower individuals to overcome these challenges.